So I want to briefly discuss the Magnus case here. This was the guy that came in from China, and he was here for like 4 days, and that's all we had time with him to work. Obviously, very serious case. This is the worst kind of case that comes into a chiropractic office. This is a medical emergency case. But of course, he went there and he got no help because they were trying to solve a mechanical problem with a chemical, and that doesn't work. And surgery, we'll link to a video on surgery in the bottom here so you can see how that doesn't work. But anyway, he came into the office and you can see he was very, very acute, very antalgic when we took the x-rays. This is the first thing before I even met him. I saw the x-rays and I immediately thought, well, he's got to be a fifth lumbar here for sure. And that wasn't the case at all. This was a case of the guy had his major problem was an atlas subluxation. He had a subluxation right here at the very top. I scoped this area. There's 5 criteria to the Gonstead system, and the first is instrumentation. I could not get an instrumentation breakdown here at all. I went over it many, many times. The only time I was getting anything was up at the upper cervical, and that's how we started there. Now, on a case like this, you do exactly what you find, which is you adjust the upper cervical, which we did. This was not a normal case. He was here from another country, I don't know, 15-hour away flight minimum. We had to do something, we had to swing for the fences on this because this guy had to get home and he wasn't getting any better if we didn't do anything. So even though I adjusted his atlas on the first day, I ended up setting a rotated sacrum on him. I didn't think I could set L5 just because of the spasm, but I set the rotated sacrum on. It's very slight rotation, but it was enough that it gave him a little bit of relief, that and the atlas adjustment. But just so everybody knows, this was an atlas adjustment case. This is an upper cervical case on this. And again, the only reason we didn't do anything, we went further than that was because we didn't have enough time for him to heal up. We had to do everything we possibly could and let him get better when he got back to China. So for the first day, I set atlas on him, and then I set a rotated sacrum. I set a left rotated sacrum on him. And then the next day I was able to set the L5, and I think I set the L5 twice after that along with the atlas, maybe even 3 times, because I was seeing him twice a day. And you can see the improvement of where he came in from to where he left. Again, he didn't give it just because of circumstance. There wasn't enough time for him to heal. The body takes time to heal. But you know, it's amazing to see what the power of chiropractic can do. And the thing that I wanted to explain in this video is this was legitimately an upper cervical subluxation case. It was not an L5 or a sacrum case like I expected when I walked in the room to see him. Again, I did the sacrum on day 1 just because I knew he didn't have a lot of time here. And there were other criteria that I used, but not this full criteria, instrumentation being the most. How you doing?
Much better.
Yeah?
Yeah.
How, explain.
Managed to more or less sleep through the night.
Oh, it's a big one.
Had a dinner last night for the first time in, 10 days sitting at the table.
Okay, all right.
For 5-10 minutes. And now also sort of sitting without too much pain.
Okay, very good.
I still have that.
We gotta make sure we're on the right bone here because just how sensitive you are right now. And well, always gotta make sure we're on the right bone, but don't want to do anything wrong on you now.
Right.
You're very fragile, if you will.
But I will have to stay for sure.
Good. Breathe out. Good. 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 Okay. Enough. Recheck you here.
Yep.
You okay?
Yep.
Okay, good. I can feel you're hot.
Well, I've been doing 1,000 of those.
Oh, you did? Okay, all right, okay.
Maybe that's why.
Okay, that could be then. That's good. Okay, very good. All right, good. Okay, So we're just going to pump out a little inflammation, and then I'm going to get you on your way, buddy. Come on over here.
Yep.
So your body is splinting you right now. It's acting very intelligently, okay? It's trying to keep you from doing anything dumb. So that's why it puts you in these awkward positions, okay?
Yeah.
So you just got to kind of ride it out as your body's healing up.
I mean, I feel tremendous progress. It's just that bloody flight, sort of 48 hours away, right? That's
Yes.
the only scary bit.
I know, I can feel you. You know, the advice in a plane is let them know when you get on that you have you're in very bad shape right now.
Yeah.
And see if they'll work with you at all. And also, every hour or so, make sure you get up at least and go to the bathroom, walk in, or they probably won't let you walk in the aisles. Right. So just go to the bathroom, walk in place in the bathroom, or maybe in the back part, if they'll let you back there.
Yeah.
I don't know what they'll let you do, but come on up, buddy. Oh, I'm gonna get you up.
Yeah.
Let me do it again if you can.
Okay. 4 days ago, 5 days ago.
About 5 days ago, yeah.
Unable to do anything really, just lying down, lying on my back with my legs up, on my stomach, whatever took the pressure off the spine, unable to have a life really. So then coming in here and getting a little bit of some touches here and there and some correction, and quite quickly after that sort of getting a positive spirit around it all. I think probably 1-2 days after my first visit I was up and walking about for 1-2 minutes, which was a huge victory at the time. And now after what, third, fourth visit, I'm up and about for 5, 10, 15 minutes. I can sort of sit up at a dining table and have dinner for 5, 10, 15 minutes as well. I mean, the before and after, I guess, can't really be compared at all, and huge progress. So yeah, quite positive about it all. Yeah. Now just a flight to China, sort of scary.
Good luck on that.
But besides that, very positive, and I'm sure it's going to be okay.
Yeah, you will be. Good, man. Excellent. Thank you for. So the encouraging thing was the day before he left, he said he was able to eat dinner with his family and sit at the table, which he couldn't even sit when he came in. So that was encouraging. The next thing he had to do was sit for a 15-hour flight to get back to China. The staff has kept in contact with him since then. He's continually improving, slowly. So chiropractic, it's absolutely incredible. Applied properly, it's incredible. Nothing could have done that from him. No drugs, clearly no drugs, because he was drugged up before he came in. He had all the MRIs, no surgery. If you're experiencing these conditions, don't wait so long. The x-ray it's atrocious because of the amount of damage there. Now, again, unfortunately, because of we didn't take an x-ray before he left. I wanted to do it, but we didn't have enough time. But you can clearly see he was standing differently at that time. But don't wait that long. It's only going to take longer to heal and be more costly for you to heal up during those times. When you have any issues, pain's something that your body is telling you that there's definitely a problem. Do something about it earlier. Get it resolved with it earlier instead of letting it get out of hand. There was many years ago, of course in the 80s, people might remember this. There was a commercial. It was called a Fram oil filter or air filter, and they used to say, pay a little now or a lot later. And that's what's going to happen because of the amount of damage. It's just going to take more time, or you're not going to be able to get better, you know, in your limited time frame. So I hope this helps. I hope the understanding of the video, why we did the things we did, why we even went outside of the Gonstead system a little bit just to help this guy, and it was just based on time.